Okay, so this is severe combined immunodeficiency, otherwise known as SCID. This is a presentation by Grayson, Frye, and Ashton. So what is SCID? Well, it's called severe combined immunodeficiency, and is a genetic disorder in which the body cannot fight infection because it has no B or T cells generating. Now, B cells are mainly related to hormonal immunity, which is pretty much your antibodies, which is what fights off your infection, and T cells, which are responsible for cell-mediated immunity. And pretty much this is your immune system, which fights off infection and keeps your body safe. It's almost like the bodyguards of your body. Now, I know this probably isn't a great way to think of it, but I know most people are familiar with the infection of AIDS. And AIDS is just like or not just like, but close to SCID, in which it destroys your immune system, keeps it from generating, and it restricts your life extremely. And usually, it's the infection you catch because of not having an immune system that kills you instead of the actual thing. The only difference is SCID is genetic, where AIDS is usually contracted from something. Now, SCID, which is also known as bubble boy disease, and we'll get into that, is when an infant is born with a non-functioning immune system, like I said. Now, the cells needed for immunity are generated inside your bone marrow, and that's where we will get many treatment options, such as bone marrow transplants and all kinds of stuff. Now, SCID is not necessarily what kills a person, but instead it's what the people contract, like viruses that kill the people. And this is why they live in a type of bubble, as you can see in this picture right here. And that's why it's called bubble boy disease. And it's pretty much the only thing that keeps them safe from viruses. So it's pretty much their physical immune system, since they have none. Now, SCID is transmitted, and it's usually sex-linked, and it's attached to our X chromosomes, and can sometimes be linked to an enzyme adenosine dementia. Excuse me. But pretty much it's usually transmitted through sexual contact, or reproducing, should I say, not sexual contact. But some symptoms that you can see will appear later when the infant is born, because their immune systems need to form, because in the first couple months they're pretty much using their mother's immune system since they have been born. But pretty much you'll see numerous life-threatening infections, possibly, or serious infections, such as ear infections and respiratory infections, and all the regular sicknesses that are not regular, I guess, but sicknesses that infants can have. Also, it's usually a failure to gain weight or grow because they're so unhealthy, and they also have constant infections in their mouths or all around their bodies, like sores. Now, ways to treat SCID are something called an HSCT transplant, which is pretty much where they take the own patient's stem cells and try to fix them and affect them so that it will help SCID form an immune system. It's pretty much like they're trying to kickstart someone's immune system. Now, there's enzyme replacement therapy, which is taking the enzymes of the patients, and in particular, the enzyme has been absent or deficient, and pretty much replacing it. So they take a donor and replace it with better enzymes, and also bone marrow transplant, because in the bone marrow is where all these cells form that you need and that are deficient in SCID. So if you take healthy bone marrow and put it into the affected person, your problem solved. But many infections can be caused by this unless it's handled properly. It was tried before, I believe, on one of the well-known SCID affected people that we will talk about in a minute, but usually doesn't work. Most of these are unsuccessful, and usually cause infections, but these treatments cannot cure SCID. They're just treatments to help better themselves. Some interesting facts I just threw in here. 1 in every 100,000 babies is born with SCID, and probably the most famous story of an SCID child is David Vetter, and he lived to be 12 years old, living in the isolation bubbles until they tried a bone marrow transplant on him, but it failed because he caught an infection during the transplant and it pretty much killed him. Also, there's a kind of famous movie out there that some people might have seen with John Travolta in it that is inspired from David Vetter called The Boy in the Plastic Bubble. And it's definitely far-fetched and it's not true, but it's based off of David Vetter's experiences. Now, here's some questions for you, and some of them are from this presentation, some of them just going to cause you to think. But so in a situation where you yourself or a child that you have SCID, what do you think your actions would be, and would you trust the treatments because they are rarely successful? Also, what are the 3 forms of treatment from SCID, and are they curing or just treatments? Because, sometimes they work, sometimes they don't. But how did having SCID affect the social lives of children themselves? As in, what did they have to do to be protected, and what did they have to live in, and how could they interact with people? And this is our Works Cited page. Thank you so much for listening.